Welcome to the VIP Med Minute. Can food be medicine even for cancer patients? Today is March 14th, National Pie Day, and we know that it's the National Nutrition Month as well. And I want to share with you one study that just recently came out that looked at medically supervised ketogenic diet, which is mostly healthy fats, moderate protein, lots of different vegetables, and low carbohydrate lifestyle. What they found is that when controlled with patients who are getting standard chemotherapy for stage 4 pancreatic cancer and regular diet, the patients who are on medically supervised ketogenic diet had increased length of survival and better response to chemotherapy treatment. So, of course, this is a randomized trial, but it is based on basic science research published earlier from researchers out of Princeton, certainly out of the Chinese Academy of Sciences and Rutgers University, that looked at pancreatic cancer cells. And when they were exposed to nutritional ketosis, they found that it changes the cellular metabolism. The oxidative stress to cancer cell goes up. So essentially, ketogenic diet makes those cancer cells more vulnerable to chemotherapy. So when it's used in combination with medical treatment, the medication treatment work better to really do damage to the pancreatic cancer cells. So exciting study that shows that nutrition, when combined with modern science, can have beneficial effect even on advanced cancer. More studies need to be conducted. I'm sure there will be. Other studies around breast cancer, colorectal cancer will also look at the role of nutrition in cancer biology and cancer treatment. So exciting news. Stay tuned. The medically supervised ketogenic diet study was based on the model with Vora Health that the tribal nation used a few years ago to launch it with food as medicine approach. So we are excited to learn more about this developing story with use of nutrition for even advanced cancer care. So at some point, we'll get the lead authors of that study onto our podcast and learn a little bit more. The cellular mechanism, as I see it, is mostly based on shifting the cell metabolism and shifting the ratio of something called NADH to NAD. Essentially, these are the elements needed for Krebs cycle and the tricyclic, acid metabolism to generate ATP, which is the energy currency. The long and short of it is there is more oxidative stress on these cells exposed to ketogenic diet, and that seems to improve even insulin metabolism. And with all these cellular basic science foundational pieces, it makes sense that in real world, advanced cancer patients seems to be doing better when their chemotherapy is combined with medically supervised ketogenic diet. Strong signal, more studies, I'm sure will come before it becomes mainstream, but oftentimes translational science of implementing what we already know works takes decades, and that should not be the case when it comes to really dismal disease with stage 4 pancreatic cancer. Stay tuned, more to come. Have a wonderful weekend.